name is Dean Bartholomew. I'm a family physician here in Saratoga, Wyoming. That's something that we do as providers is trying to delineate, is this a viral cold that's going to run its course? Is this possibly influenza? Normally what I tell my parents for a viral cold, it's okay to have a fever for about the first 72 hours. That's the body's natural response to fighting off a virus. After 72 hours though, usually that fever is going to abate. And so if the fever lasts longer than 72 hours, or especially if the fever goes away and then it comes back, that's when we get worried about things like ear infections, pneumonia, or some type of secondary infection. Influenza usually is quite a bit different, quite a bit more severe than a cold. We'll see higher fevers, we'll see much more cough, maybe more congestion. The biggest thing is going to be breathing. When we're talking about respiratory infections, colds, influenza, it all comes down to the breathing. And little guys, they're pretty good about showing us what's going on with their breathing. And so if it's gone from where they're uncomfortable and they're sneezing, they're coughing, they're having to deal with that mucus, to now they're really struggling to breathe. Sometimes we'll see the skin will kind of retract over the top of the bones here, underneath the ribs here. If there's a point where just as a parent, you're uncomfortable that the child just seems to be working too much, then we need to see them.